In Washington, U.S. President Donald Trump is escalating his attack on the World Health Organization about its handling of the COVID-19 pandemic. He wrote a scathing 4-page letter to the WHO's Director General, released it on Twitter late last night, in which he says it is clear the repeated missteps by you and your organization in responding to the pandemic have been extremely costly for the world. The only way forward for the World Health Organization is if it can actually demonstrate independence from China. Katie Simpson is in Washington on the story for us. Katie, tell us a little bit more about the ultimatum Trump has delivered.
Well, Donald Trump is threatening to permanently end funding to the World Health Organization, as well as revoke the American membership in the WHO because of what he says are the missteps that the organization took in the early response to the coronavirus. And what he says was its failure to press China for answers and really downplay the concern facing the world in, again, those early few responses. He posted this letter on Twitter. It's 4 pages long, and it outlines his deepest concerns about how the World Health Organization handled its initial response. And he says, we'll bring up a part of that letter right now. He says, if the World Health Organization does not commit to major substantive improvements within the next 30 days, I will make my temporary freeze of United States funding to the World Health Organization permanent and reconsider our membership in the organization. So this is a very serious threat, and it's delivered on the second day of a 2-day virtual meeting by members of the World Health Organization and some observers. This is supposed to be a 2-day meeting to discuss the coronavirus, but it's really been overshadowed by the ongoing feud between Washington and Beijing. Now, Donald Trump has repeatedly lashed out at China, repeatedly lashed out at the World Health Organization, trying to place blame for this pandemic that has crippled the U.S. economy and has caused caused extreme. More than 90,000 people have died in the United States, and more than 1 million people have coronavirus. So he is really, in a number of occasions, lashed out at China and the World Health Organization. However, it's possibly seen, Trump's response is possibly seen as a response to what we heard from President Xi Jinping yesterday at this organization, at this meeting. He promised $2 billion to help fight the coronavirus, but many critics of China are seeing that as a way to deflect attention from China's initial response to this.
Katie, something else that must be the talk of Washington. I mean, we know that there are 2 White House employees who have tested positive for all of this, and we learned from the president yesterday he's been taking an unproven drug preventatively, hydroxychloroquine. Tell us more about that decision.
Well, Donald Trump really surprised many people in Washington when he voluntarily disclosed that he is taking this unproven anti-malaria drug that is also used to treat other conditions, including lupus, as a preventative measure to protect him against coronavirus. Have a listen.
The frontline workers, many are taking it. I happen to be taking it. Hydroxychloroquine?
I'm
taking it, hydroxychloroquine. Right now, yeah. A couple of weeks ago, I started taking it because I think it's good. I've heard a lot of good stories. And if it's not good, I'll tell you right, I'm not going to get hurt by it.
There have been a lot of doctors going on cable news networks as well as regular news networks to express their concern about this, concern that the American people may follow in the president's footsteps, given that there are some serious side effects with this drug that could potentially be fatal. It could have serious effects on a person's heart if they have pre-existing conditions, and there is deep concern that this could lead again to widespread shortages of this drug.
Katie, thank you very much. Really appreciate it. Katie Simpson in Washington. We were talking about it on this network as well with Dr. Isaac Bogosh, our infectious disease specialist, when we were speaking earlier, hydroxychloroquine, and I asked him what he thinks about what the U.S. president said, his taking this unproven drug.
To date, we don't have evidence suggesting that hydroxychloroquine will be an effective treatment or prevention for a COVID-19 infection. There are some smaller studies and some evidence that's out there that are, from imperfect studies that most of them show that hydroxychloroquine doesn't really do anything in a COVID-19 infection. There's been a few shreds of data saying maybe it's protective. Most say it's not. But in terms of having the large, well-designed clinical trials available, we don't have those results available. They are coming soon. I think the key thing here is we don't know whether this works or not. And of course, like anything else, drugs have side effects, and especially this one. They can have neurologic side effects. They can have cardiac side effects. No one should be taking this medication unless it's prescribed by a physician.